I'm just so happy to have Simon Nye here with us again today. We promised we'll bring him back and talk about craniosacral therapy, so welcome.
Thank you for having me back.
Yes, so craniosacral is one of those most incredible, subtle, beautiful, mysterious modalities. I took a few classes and I've had lots of treatments. But please tell me, why did you choose that particular modality, or did it choose you?
Well, I'll quickly touch on why before we talk about what it is, because not many people are familiar with it, I find. Why? It was just my path. Once I put aside the money-making publishing career path, I came back to what powers my soul. And it was interacting with people and hoping that after the interaction, that person leaves better, feeling better, a better person. It could have had many forms. And coming from a healing and health-oriented family, it was a natural choice, pardon the pun. So if I may define, what is craniosacral therapy?
What is craniosacral therapy?
So it gets its name from the body system, which is the craniosacral system. Cranio, it refers to the skull, and your sacrum is your tailbone, or just above your tailbone actually. And that encapsulates really your central nervous system, which governs everything that we do, we experience, we feel. It's like a big computer that all the experiences come in through there, and to do anything, we have to use that system. So if that system's health is impaired in any way, that can have such far-reaching effects on any aspect of life, from mental, emotional, physical, spiritual. It's quite profound, really. But what I like to do, my interest is in trauma and stress.
Right.
So trauma, I would define as anything that overwhelms your nervous system's ability to cope. And that's different for everyone. And when the body gets overwhelmed, it goes into defense mode. And the body's defense mode, one of the options is to restrict. So it limits the amount of space that is being affected and contains it into a small area, which is wonderful because it allows us then to go on. The example I like to use is if you are walking on the mountain and you injure your knee is going to inflame, it will swell, the muscles around it will tighten to help protect the injury from getting worse. What we want then is for that restriction and that the acute effect to naturally be relieved, and then you heal and you're left with the full use of your leg again. Unfortunately, people are too stressed nowadays to be sick. You've often heard, I'm sure, I can't be sick today.
Yes, exactly.
Yeah, and we're just talking about sickness and health, but anything. People want to push forward, and we're not allowing ourselves the time to heal, which our body is amazing at doing if we allow it. So the role of the craniosacral therapist is to facilitate the release of these restrictions. Now, I'm more of a mechanical craniosacral therapist. You get the biomechanic, who work more with the bones and the membranes and the physical structures is our concern. And then you get the other end is the biodynamic, which is more about the energy systems of the body.
But practically they're still the same. I mean, you still stand behind the person, starting with your hands underneath the head.
Or the feet. Often we stand at the feet. But yes,
right.
you will hold different positions. But where the biodynamic person, more energy-based, would have their attention more on the energy fields of the person and acting as a tuning fork, where they get the right resonance and then allow the other person to come into coherence with that. Whereas the biomechanic is more interested about how is the body responding, and I'll tell you about that system now. So the biomechanic, we're looking at the cranial rhythm. So in your central nervous system, you've got your brain, your spinal cord, all the way down to your sacrum, and that's encapsulated in a triple membrane. And so it's waterproof. It doesn't easily let things across. It's very selective what can come in and out because it's protecting and feeding your brain. It's a very carefully controlled environment. But what we get is a pressure stat model. So the fluid is inside, and that whole, think of it almost like a tube. If you squeeze one end of the tube, it's going to bulge on the other end. If there's a restriction in any place of that tube, it can't expand as it needs to.
And it runs up and down. It doesn't flow one way.
Well, there is a flow. to it. We don't, well, not everyone looks at that mechanic of the flow. What's important is the creation of this cerebrospinal fluid and the absorption. So it's fascinating because we've actually got 3 body rhythms that go on. We've got the heartbeat, we all know about. We've got the breath, so call it the lung beat. But then we have the brain beat, which is this craniosacral, cerebrospinal fluid that gets produced and absorbed many times every minute. And that creates a pulse in the body.
Why I said the flow is because, well, 2 things. First, I just need to say that some people have a fear of undressing in front of a therapist. Not undressing in front of a therapist, but, you know, being half naked on a table and being touched by a stranger. This treatment is fully closed.
Absolutely.
And the other thing I want to say is when I've experienced either giving a craniosacral therapy or receiving, it felt like I was feeling the rhythm of a washing machine. It kind of had that kind of rhythm to its cyclical rhythm, but it can be quite strong.
It can.
And I mean, unless you know what to feel for, you'd miss it. Your whole life can go by and you never experience that incredible sensation of having this fluid running through your body up and down your spine.
Indeed.
It's amazing.
So what you're feeling when you have your hands onto a body is how the tissues are responding to that increase in pressure and the decrease in pressure. And each part of the body moves in a different way and will rotate on different axes or move in a different arc. Even the teeth rotate in their sockets very slightly. But that is what the training is about, is to feel that and palpate with your hands. And there's the real skill. So what we do in a session is we'll lightly apply hands over the body at various points that are key listening areas, listening with our hands, and identify, is it flowing and expressing the cranial rhythm, expressing that motion of that particular body part correctly? Or is it perhaps not expressing it all on one side? Or does it happen on one side and then the other?
It can be quite off balance. It can actually pull a person completely off balance. I once had a little girl who lost her mum. And that treatment, I mean, it was completely off balance. It was quite a long time to get the rhythm to flow. And is that your aim?
Yes. So we don't say that we know the body perfectly. The body is far too amazing and intricate for any one person to really know. But the body knows how to heal itself. And we know how to find restrictions and get them out of the nervous system and out of the tissues of the body, which impact on the nervous system, because we're a whole body. We're not just a piece.
I like the word restriction.
Yes.
Because most people use it as a blockage. And that, to me, you know, your words are quite powerful.
Yes.
When you say blockage, you can almost then imagine a blockage and you can make it worse.
And it's absolute. A blockage is where it's stopped, but restriction is just where it perhaps slows down or doesn't work as well as it should. So the job of the therapist is to identify where the restrictions are in the body and then help the body to release the restrictions. And I love to compare it to chiropractic. Which
I wanted to ask you, what would the difference be?
Yes, I'm not putting down chiropractors, but it's just a different model, and it's very useful because a lot of people do know chiropractic. So I often say that chiropractic is a lot of force over a little bit of time. For example, crack.
Sure.
Whereas craniosacral therapy is the exact opposite. We're taking a very light force, about the weight of, I think, of a 5 Rand coin resting on your skin. It's very light. You think it couldn't do anything. But you apply that for 1 minute, 5 minutes, 10 minutes, 20 minutes even. And the body accepts that intervention. It's not protecting itself against the therapy. And then you only get a little bit of benefit. So it's relaxed and can relax into it and receive.
I have to share this though.
Okay, go ahead.
Because about 10 years ago, I've had my child fall off the back of an open vehicle. And I took her to a chiropractor every Tuesday. And I mean, I love my chiropractor. He's done incredible work for me, but we just could not get her right.
Yeah.
And I finally took her to a craniosacral therapist. One session, she was fine. It's the memory of that impact and the fear of falling out. Do they know I fell out?
Yes.
That caused them that trauma to lock in the body. So structurally you can do what you like, but emotionally it holds that pattern.
Still going to go back, yes.
So Simon, I've experienced it working in one session. Is that all you need, or is there like a set amount of sessions you need to book?
Everyone's an individual. So some people can get the effect they need on just one, and other people need more time to almost unpeel the layers, if you think of it like that. And what we want is that people don't have to come and see us. So we'll work firstly with acute, so maybe every 3 days, 7 days, and slowly we'll increase the frequency of the sessions until the symptoms disappear in between. And once that happens, then we can lengthen and we say, okay, well, can you last on 2 weeks, and then a month, and then 3 months, and 6 months. And
you're saying that there's people who come to you for their monthly top-up?
I have people who come to me who just enjoy it because they have a stressful lifestyle, a lot of anxiety, and they find it just helps them to breathe.
So it takes the edge off.
Yes, and it helps them just reset their stress thresholds a bit, which is what we do. But then there are people who come for specific problems like ear issues, eye issues, emotional issues, and those we wean off when they're better.
So you can literally have someone lying there crying.
Yes.
What is the most powerful experience you've had as a craniosacral therapist?
Well, I have had the emotional releases on the table, but the most powerful one I had was when I was doing my training, actually. I had a dear family friend come to us who was an aromatherapist, but she lost her sense of smell. So it was tragic. She had an injury to the back of her head and smell gone. And I worked with her for a few sessions, and I was holding her occiput, the skull bone at the back of the head, and just being with her, responding to the body. And then there was this very sharp and loud quack, quack, quack sound. It actually sounded like when a bone breaks. You get this loud crack and grind.
Wow.
And I snapped out of the calmness we had. I thought, oh my word, what's going on?
What have I done?
I had a look and it's like, nope, she's fine. She's not even aware it was going on.
Wow.
And then it settled down again. And after that session, she tells me that she started smelling again. And she slowly regained her sense of smell over increasing sessions, which was just, for me, at that point, the most gratifying. Although I know it's not me doing the healing, it's her, I was just lucky to be a part of it.
So it's such a broad application, though.
It is.
And for every age.
Yes.
From little ones through to the elderly, I'm sure.
Absolutely. Any stage of life, you can have people. And you'll just find your practitioner who prefers one area or not. And I just want to touch on the history of where we come from. Before anyone thinks that this is, airy-fairy, it's not. It actually comes out of Western medicine. A man named William Sutherland in the United States was studying osteopathy and cranial osteopathy, so how the bones in the head work and articulate, in the early 1990s. And he was fascinated by how the skull bones fit together and move, so the anatomy of them. And now, of course, everyone knows that the skull bones are fused and they don't move. And that's what he was taught, and that's what's still taught in the West. But he looked at the shape of the bones and he thought, no, these, they're not just flat joints, they interlink and they grooves like gills. And it just, to him, it screamed motion, that these are made to move. And the body is not silly. If it looks like it moves, it might move. So he started to investigate this further. And he started to palpate people's skull bones and, see what he could feel and he could pick up with his hands, this rhythm that was previously undiscovered. And not even undiscovered, but it was said to be impossible. There is no movement, they said, but he was finding it. And he went down quite a long road of discovery of the system. And out of that, craniosacral therapy came about. So it was first the biomechanics side, the very physical aspect, and then the progression is the biodynamic, moving more into the energetic side.
Was he the guy that had quite the experiments on himself, and
Yes.
his wife had to assist him?
Exactly. And he wore a helmet
Yes, he wore a
that
helmet.
pushed on different parts of his head, and he would turn a screw and push on one place, and had the craziest reactions. A true scientist.
Wow.
So it's got that firm basis from the osteopathy. It's just a newer form, or an extension of it.
And you have an association now in South Africa?
Yes, we do. The association has been around for quite a number of years, and at the moment it's in an upswell where we're trying to share this with more people, and also to have registered practitioners on there. So there are a number of people who are offering craniosacral therapy, but they aren't with us at the association. And so, as you know, with associations, they help and monitor and protect and make sure that everyone gets the same and doesn't give
So important,
modality.
Simon.
Yeah.
I've had a woman 20 years ago coming from the UK and doing craniosacral therapy on me, and what I know now and what I experienced then was miles apart.
Yeah.
She was definitely not a craniosacral therapist.
Yeah.
I don't know what she wanted to be, but she actually, you can cause harm.
You can.
You need to be trained and qualified. So people need to look for a therapist in the association.
Yes, so officially we're called the Craniosacral Therapy Association of Southern Africa, and we list all of our members there, and we have good information about what we do. So I'd urge anyone who wants to find out more about this to go through there and find a practitioner.
We'll put a link at the bottom of the video.
Okay, good.
Thank you, Simon. Appreciate it.
Thank you very much.
It's lovely seeing you again.
Good to be here.